What if we can avoid this oxygen crisis in India just by a simple technique? Hi, welcome. Low dose radiation therapy, LDRT. This is not a new technique. Way back in the early 20th century, this technique using low dose radiation, people used to treat pneumonia caused due to bacteria or other infections. But later on, with the invention of newer antibiotics, this technique was slowly forgotten and discarded. But now, in the COVID-19 situation, people are developing cytokine storm and the lungs are severely badly damaged. Because why we use low dose radiation therapy to treat COVID-19 patients? So first you should know about the inflammatory process that's inside your lungs. During the coronavirus attack on your body activates an immune system. Your lungs will recruit inflammatory cells from the blood in order to protect your lungs from the infection. But in some people, what happens exactly is there will be activation of the inflammatory cells, which leads to cytokine production. And these cytokines will flood the lung with other inflammatory cells, and they too produce the cytokine. In this way, both the lungs will completely get damaged because of the flooding of the inflammatory cells. So, what is this called? This is called cytokine storm. Once the cytokine storm sets in, the patient deteriorates rapidly. So there will be a lot of oxygen support requirement for the patient. Even after the oxygen supplementation, we cannot guarantee the life of the patient. So we radiation oncologists, what we have done is specifically select those people who require oxygen requirement, whose saturation is less than 95%, whose inflammatory markers are raised. We will select those patients, recruit them into our study, and we will give a low dose radiation therapy LDRT to both the lungs. What we do exactly is the inflammatory cells which are present in the lung will be damaged by the low dose radiation therapy which we give to the lungs. So the inflammatory cells cannot give an over exaggerated immune response. So the oxygen requirement will slowly decrease and the patient will retrieve to normal oxygen saturation. There are multiple studies going on about this topic. Now, we radiation oncologists, along with discussing with the anesthetist and intensivist, were going to start this study, these trials in India. For further details, you can contact me, comment me in the comment section. So I will be helpful and useful to explain you about this low dose radiation therapy in detail for you. So thank you.